There's a habit millions of us share, one that seems completely harmless, yet it's the leading cause of acute liver failure in the developed world. I'm talking about acetaminophen, a drug so common we often forget it's a powerful chemical that your liver has to process every single time you take it. It's the most common drug ingredient in the United States, found in over 600 different over-the-counter and prescription medications. You know it as Tylenol or paracetamol if you're in Europe or Australia. It's in everything from pain relievers to sleep aids. But here's the reality. Acetaminophen overdose accounts for over 56,000 emergency department visits and 2,600 hospitalizations every year. In fact, it's responsible for nearly 50% of all cases of acute liver failure in the US and remains a primary reason for liver transplants. Most of these cases aren't intentional. They happen through something we call therapeutic misadventure, unintentional overdoses that happen easily. Imagine you have a cold. You take a multi-symptom nighttime liquid and then you take an extra strength painkiller for your headache. Without realizing it, you've just double dipped. Both products contain acetaminophen and you've just pushed your liver past its safety limit. Statistics show that roughly 40% of people who suffer liver failure from an unintentional overdose took two or more products simultaneously. The margin between a safe therapeutic dose and a toxic one is surprisingly slim, much slimmer than most people realize. To understand the danger, we have to look inside the liver. Your liver is a metabolic powerhouse, processing everything from food to medicine. Normally, the liver processes acetaminophen through safe pathways called glucuronidation and sulfation, turning it into harmless waste. However, a small percentage, about 5 to 10%, is processed by a different enzyme called CYP2E1, and this is where the trouble starts. This pathway creates a highly reactive and toxic metabolite called NAPQI. It's a chemical that is essentially a poison to your liver cells. Normally, your liver has a defense system, a powerful antioxidant called glutathione that neutralizes NAPQI before it can do any damage. But when you take too much acetaminophen, you saturate the safe pathways and overwhelm your defenses. Your glutathione stores are completely wiped out. Once that glutathione shield is gone, NAPQI is free to roam. It binds to the proteins in your liver cells, causing massive oxidative stress. This leads to something called cellular necrosis, literally the death of your liver cells. This damage can happen with terrifying speed. In a severe overdose, significant liver injury can manifest in as little as 24 to 48 hours. By then, it may already be too late. So, what is a safe dose? For a healthy adult, the general maximum daily limit is 4,000 milligrams. That's roughly 8 extra strength tablets. But that threshold is for healthy adults. Liver specialists warn that the margin for error is smaller than we think, and it's not universal. One of the biggest risk factors is alcohol. Chronic alcohol use, or even just 3 drinks in a day, induces the enzymes that create that toxic NAPQI. If you drink regularly, your safe limit drops drastically. Even 2,000 milligrams, just 4 extra strength pills, can be dangerous for you. Your nutrition matters too. People who are malnourished or underweight have lower baseline levels of glutathione, meaning they have less shield to begin with. If you already have liver disease, like cirrhosis or hepatitis, you should ideally avoid acetaminophen entirely unless directed by your doctor. We must also be incredibly careful with children. Poisoning is common due to weight-based dosing errors or using adult formulations by mistake. Always use the measuring device that comes with the medicine. Never guess, and never use a kitchen spoon, which can lead to a dangerous overdose. The FDA has taken notice of this crisis. In 2014, they mandated that prescription painkillers like Vicodin limit acetaminophen to 325 milligrams. They found that higher doses didn't offer more pain relief, but significantly increased the risk of liver failure. They are trying to build in a safety margin. Recognizing an overdose is difficult because the early signs are deceptive. They often mimic a common flu, nausea, loss of appetite, and general malaise. As the damage progresses, you might feel pain in your upper right abdomen, but by the time jaundice, the yellowing of eyes and skin appears, the damage is severe. The good news is that there is an antidote called NAC or N-acetylcysteine. It works by directly replenishing your liver's glutathione stores. NAC is incredibly effective if given within 8 to 10 hours of the overdose, but every hour you wait, the chances of irreversible damage go up. Scientists are working on even newer treatments, identifying cells that can help the liver regenerate itself after severe injury. New molecules are being tested to reduce the inflammation that makes liver injury worse. But for now, prevention is your best and only real defense. If you even suspect an overdose, do not wait for symptoms to show up. Symptoms often don't appear until the damage is already done. Contact poison control or get to an emergency room immediately. Tell them exactly what you took and when. It could save your life. Your primary defense is reading labels. Every single time, look for the words acetaminophen, a PAP, or paracetamol. If you're taking multiple medications, write down the doses and the times. It's the only way to be sure you aren't accidentally crossing that safety line. When in doubt, ask your pharmacist. They are experts in drug interactions and can tell you exactly which products are safe to combine. Remember that drugs aren't always the only answer for pain. Physical therapy, ice, heat, and rest can often reduce the need for high doses of painkillers. Your liver performs over 500 vital functions for you every day. It's incredibly resilient, but it isn't invincible. Give it the respect it deserves. By staying informed and checking those labels, you can use these medications safely and effectively without putting your health at risk. I'm here to help you navigate these medical facts so you can live a longer, healthier life. If this information was eye-opening, please hit that subscribe button. Join us at the Adult Health Hub for daily insights that put your health back in your hands. Thank you for watching and stay safe out there.